So the EMS agenda for the future outlines 14 full components of the EMS system. There's public access, clinical care, medical direction, integration of health services, information systems, prevention, EMS research, communication systems, human resources, legislation and regulation, evaluation, system finance, public education, and education systems. And this is kind of how it all works together. Like all 14 components, making sure that everything happens from public education trying to prevent, and then what happens after an incident is occurred. Public access and communication systems. So this is trying to make sure that easy access to help when there's an emergency is available. So this is the creation of the 911 system as a public safety access point. At the communication center, you've got trained dispatchers that obtain information and dispatch the ambulance crew and other equipment and responders as needed. The Emergency Medical Dispatch System, or EMD, has been developed to assist dispatchers in providing callers with vital medical instructions until EMS arrives. So they actually can walk people through how to stop bleeding, how to perform CPR, basic life support type things, just so that care is being provided in the interim while we can get there. There's also new technology that can help responders locate their patients. Sometimes we can utilize GPS on cell phones in order to figure out where a patient is at least calling from, if not where they're actually located. Clinical care describes the pieces of equipment as well as our scope of practice for using that equipment to make sure that we can render emergency care to our patients. Familiarizes the EMT with the primary service area and ambulance controls as well. So primary service area is the clinical geographical region for which we'll provide care. And then ambulance controls, there's a lot of buttons and switches to controlling an ambulance, so learning how to use those appropriately. Human resources focus mostly on the people who deliver the care. The EMS agenda for the future encourages the creation of systems to help protect the well-being of EMS providers, including the development of career ladders. Medical direction is absolutely essential to any EMS system. The physician medical director authorizes EMTs to actually provide medical care in the field. They are in the supervisory role. The medical director is an ongoing working liaison between the medical community, hospitals, and the EMTs in that service that they work for. Appropriate care is actually described in standing orders and protocols, is what we call them. Protocols are described in a comprehensive guide that delineate the EMT scope of practice. Standing orders are parts of the protocol and designate what the EMT is required to do for a specific complaint or condition. So somebody that is having shortness of breath, for example, we would have a protocol for dealing with shortness of breath. It would outline exactly what we need to do from a medical person's standpoint to take care of that patient adequately. Within there might be some standing orders on medications that we can give or other treatments that may be in order for that specific patient. Medical control can be one of two ways. So this is either offline or online. We're not always required to consult medical direction before implementing standing orders, but there are times when we're going to want to get in contact with a physician to make sure that what we're doing and what we're seeing is correct. So offline or indirect, this is standing orders, training, supervision, so you're not actually talking directly to a physician. And then online is that you're actually talking to the physician over the phone or over a radio, and they're giving you advice for how you need to continue to treat your patient appropriately. Legislation and regulation. Although each EMS system, medical director, and training program has latitude, Its training protocols and practices must follow state legislation, guidelines, rules, regulations. There's no way around that. A senior EMS official is usually in charge of necessary administrative tasks such as scheduling, personnel, budgets, purchasing, and vehicle maintenance, as well as the daily operations of the ambulance and their crews as well. Integration of health services. So pre-hospital care should be continued in the emergency department to ensure that the patient receives comprehensive continuity of care. So yeah, we start over and we ask a bunch of the same questions over and over from different levels of care. But truthfully, they shouldn't have to restart and do everything that we have already done in the field because we've already done it. It takes time to re-go through all of those questions and all of those treatments that we have already started in the field. So they should be able to pick up the patient with a really good report and just continue to run with that care so that the patient isn't having to wait for the care that they need. Mobile integrated healthcare, so also known as MIH, is a new method of delivering healthcare that utilizes the pre-hospital spectrum. MIH evolved as a result of the Patient Protection and Affordable Care Act with the goal to facilitate improved access to healthcare at an affordable price. The MIH model, healthcare is provided within the community rather than at a physician's office or hospital by an integrated team of healthcare professionals. This is a very, very new branch of healthcare. It's causing the evolution of additional training levels for EMS providers. So you have to have additional training for this, and we actually call these community paramedics. So one new aspect is this community paramedic, in which experienced paramedics received advanced training to equip them to provide services within a community. In addition to patient care services as a paramedic, they would likely provide services that include performing health evaluations, monitoring chronic illnesses or conditions, obtaining laboratory samples, and then administering immunizations out into the public so that those people don't have to come into the hospital or to the doctor's office to receive that kind of care. Evaluation, the medical director maintains overall quality control for the ambulance, make sure that they're doing what they're doing. Continuous quality improvement or CQI reviews and performing audits on the EMS system help identify areas for improvement and or assign remedial training to personnel that need it. This is overall goal is minimizing errors. Information systems, computer systems are used to document patient care. Once stored electronically, the information can then be reviewed to help improve upon care so that the next patient receives even better care. System finance are going to vary depending on which organization is involved. Personnel may be paid, volunteer, or a mix of the two. So it kind of depends on your system. EMTs may be asked to gather insurance information from patients, secure signatures on certain documents such as HIPAA notifications, and obtain written permission for patients to bill their health insurance company. That's typically, we have our patients sign our patient care report that allows all of those things to happen. Education systems, EMS instructors are licensed in most states, including South Dakota. We have an instructor coordinator society. Most EMS training programs must adhere to national standards established by two accrediting organizations. So the Committee on Accreditation of Educational Programs for Emergency Medical Services Professions. It's a very long word. We just call it the COAMP, or COA actually is what I call it for short. And they actually are overseeing our paramedic program that we have, as well as the Commission on Accreditation of Allied Health Education Programs, also known as CAHEP. So they make sure that we're doing what we're supposed to be doing, and this is for an ALS level. We don't have anybody that's kind of overarching on EMT. We have to get certified with the state to be able to host the class, but they don't come in and audit any of our stuff. ALS training is usually provided by a college, adult career center, or hospital setting. Our program is college-based. Information and skills in emergency medical care are constantly changing. So you have to have continuing education and refresher courses on an annual basis, preferably, so that you can maintain your skills and knowledge, because you're not always going to have patients that are going to test your entire scope of practice. And if you don't use those skills and that knowledge bank, we don't want you to lose them. For recertification, you have to do continuing education hours on a biannual basis, so every 2 years. Prevention and public educations, there are aspects of EMS where we focus on public health to examine health needs of the entire population with the goal of preventing a lot of those health problems. So you can prevent it much better than having to treat it afterwards. EMS works with public health agencies in order to look at primary and secondary prevention. Primary prevention focuses on strategies that will prevent the event from ever happening. For example, educating the community on pool safety, making sure that car seats are installed properly. And then secondary prevention occurs after the event has already happened. So, for example, teaching somebody that the use of helmet or seatbelt that may help what happened. Really, the key question in secondary prevention is how can we decrease the effects of the event if it's going to happen? And here's kind of some examples of what we've been able to do with public health. EMS research is a relatively new concept. A lot of what we used to do was just, hey, this sounds like a great idea, let's do it this way. Now we're actually looking into what's called evidence-based practice, so that we know that what we're doing is actually in the best interest of the patient. So research helps determine and shape the impact of EMS in the community. And then you can apply those evidence-based practices as an integral part of functioning as an EMS provider. Patient care should be focused on procedures that have been proven to be useful in improving patient outcomes. And all aspects of the EMT role are currently being researched and continue to be researched over and over, just to make sure that we are staying with the changing world. EMTs may be involved in research through gathering data. So that's why correct and thorough documentation is absolutely necessary. Other roles and responsibilities of the EMT, doesn't matter whether they're paid or volunteer: keep vehicles and equipment ready for an emergency, ensure the safety of yourself, your partner, the patient, and bystanders, operate the emergency vehicle, be an on-scene leader, perform an evaluation of the scene, call for additional resources as needed, gain patient access, perform patient assessment, give emergency medical care to the patient while awaiting the arrival of additional medical resources, if that's what you've called. Give emotional support to the patient's family, and other responders. Maintain the continuity of care by working with other medical professionals. Resolve emergency incidences. Uphold medical and legal standards. Ensure and protect patient privacy. Give administrative support. Constantly continue your professional development. Cultivate and sustain community relations, and then give back to the profession overall. Professional attributes that we look for in every future EMT is integrity, or adhering to a code of fair and honest behavior; empathy, being aware of and thoughtful towards the needs of others; self-motivation, discovering problems and solving them without somebody directing you; appearance and hygiene, using your persona to project a sense of trust, professionalism, knowledge, and compassion; self-confidence, knowing what you know and knowing what you do not know and being able to ask for help; time management, performing or delegating multiple tasks while ensuring efficiency and safety; communications, understanding others and making yourself understood to others; teamwork and diplomacy, being able to work with others; knowing your place within a team, communicating while giving respect to the listener; respect, placing others in high regard or importance, understanding that others are more important than you; patient advocacy, constantly keeping the needs of the patient at the center of care; And then careful delivery of patient care, paying attention to detail, making sure that what is being done for the patient is being done as safely as possible. And we'll be done here.